All right, I'm here with Sarah Turner from...
CeraThrive.
All right, so Sarah, tell me, how are your products different than all the other red light stuff on the market? What makes you guys distinct?
So the main thing is it's a brain red light device targeting brain wellness. So there are some other brain red light devices on the market, but not many. It's kind of a new frontier is to use red light for this application. Also, my device is targeting the gut-brain connection, and as far as I know, it's the only one.
So talk to me about that. When you say the gut brain, like what kind of symptoms or things are we trying to treat with that?
So at the moment, it's a wellness device because of the regulations. So far, everybody's working towards clinical approvals for a brain health application. So things that people are working on are TBI, concussion, Parkinson's, Alzheimer's, neurodegeneration, cognitive decline. From a wellness application, of course, we can take someone from a baseline of where they're at to better. So improve memory, better sleep, focus, performance, leaky brain, leaky gut.
So that was kind of my next question with the gut tie-in. I understand the TBI standpoint, but what kind of gut symptoms are you seeing that ties into this?
So the health of the brain is intrinsically linked with the health with the gut. You know, there's a whole new science now about the microbiome and how your microbiome relates very directly to your brain health. You know, things like brain fog, it's probably one of the symptoms of having dysbiosis in your gut. That's what causes the brain fog, and even conditions like addictive personality disorder, Asperger's disorder, all of those things are now linked to a dysbiosis in the gut. So from my point of view, you really do need to treat the gut if you want to optimize your brain. So, there's a direct connection. Certainly like Parkinson's, there's already now a very direct correlation between what's going on in your gut and the symptoms that you have in your brain.
So now with the red light modalities that you guys are doing for the brain and for the treatment, is it optical? Is it onto the cranium? Like how are you guys applying that?
Yeah, good question. So we're using a headband to direct long wave light, so that's red and near infrared, because the near infrared is a longer wave, so it will penetrate deeper into the body. So we're using it directly across the forehead, so you haven't got hair as a barrier. We do have one little module that goes on the back that's targeting the cerebellum, but mainly we're putting light through the forehead, so directly onto the prefrontal cortex there. And we're also modulating that light, so you can pulse the light at certain brainwave frequencies to enhance that effect. So it's kind of photobiomodulation plus neuromodulation in this device.
So as a nerd, I'm curious, how are you testing this? I mean, you're obviously applying the light, but how are you testing the outcomes or the shifts, whether it's the brain waves or things like that?
So at the moment, with the testing that I'm doing on my device, is I'm using other wearables. So I'm using, like for example, I have an Aura ring, I have a BioStrap, I have various other data collection devices. I can also do QEEG before and after. So that's how I'm testing this device. When you look at the literature, people are using all kinds of blood biomarkers. That's something especially for neurodegeneration that people are looking at. So there is quite an extensive way that you can test to see how these devices are having their effect. And also, of course, people are using Petri dish studies. People are looking at cells, what actually happens to these cells. So there's a lot going on. But from a clinical point of view, I'm using mainly heart rate variability and QEEG.
Now, you strike me as someone who's very academic. How did you shift into having a product and putting it out to the market?
Yeah. My background is science. So I came from a science background. I was a research scientist in a pharmaceutical company, and then I moved over to more alternative research, but still doing the science. I got involved in light therapy for the brain because my qualification is neuroscience. So I wanted to see if it worked. So, I went and actually did some hands-on on a study, but the devices were really clunky and big and not very user-friendly. And so I designed a device, and really my intention was just to get that made for myself and the people that I was coaching. But of course, when I went to the manufacturer, they're like, okay, brilliant, great idea, we love it, but we want to start a company, so if we're making this device, we're in it together. So I'm kind of an accidental entrepreneur. I never intended to have a company, but here I am, 3 years later, and we're just about to launch this product. So it wasn't something that I set out to do, it's just something that's evolved.
I love that. I love that you came into it not with profits in mind, but more about making purpose and making a difference. So tell me, because I have a really good friend, Dr. Jasby, who he came from academia and he's in the same spot of you, and he's struggling watching the industry because there is such a lack of qualified researchers. Has that been a struggle for you at all, being in this industry and seeing that there's so much pseudoscience, but there's no one actually researching it?
No, because I'm tapped into a lot of the researchers who really are like top of their game in this industry. Actually, people are very approachable because people want to get this message out. So I've been able to go, really to the top schools, even I'm from England, as you can probably hear, at Durham University, the professor of bioscience, I just rang up, he's like, sure, yeah, come up, let's see what we can do. People are very accessible because this is kind of a frontier science and people want to get the word out. So I've found not at all. There's a lot of very good, credible science that's very accessible. It's just, as you know, with all these alternatives, there's little funding. So it's not like there's huge trials going on. There are little pockets all over the States, or, in various countries where they're doing very, very good technical research. It's just small at the moment.
I'm also finding, especially being here with such an international presence, that America, we're behind on all of this stuff from the medical and the research standpoint. We have the business side, but I was talking to a girl earlier where they have cryotherapy chambers in hospitals in different parts of Europe that we would never think about that here.
Yeah, it's different things. Actually in the States, there's a lot of very, very good research happening here. But of course, every country has its own idiosyncrasies with regards to what's going on. And certainly, I was in India last year, and they have light therapy in all of their hospitals. They're doing it for diabetes. They're doing it for all kinds of things that other countries are not doing. And sometimes it's necessity. Maybe they don't have access to the pharmaceuticals, and that's actually helped them go further with some of these techniques.
Well, it's interesting you say that because I feel like the pharmaceutical, there's so much money in it, it's hard for us to shift away.
Yeah, there's money, and also we're very entrenched in that paradigm right now. That is kind of, doctors are trained in that. That's the first go-to, is what is the pharmaceutical intervention. So it's a big hurdle to get over that. It's not just the money, and you're right, the money is a huge piece of it. Obviously, there's huge profits, but it's also people's mindsets. People are conditioned to, first of all, look for a pharmaceutical intervention.
So let's come back to your product. So I want to talk about this. Is the product out to market yet, or is it launching soon?
Launching soon. I'm just about to go into production. Actually, this is the week that I go into production. I've just done my test unit, so imminent, let's say.
Now, are you guys looking to be more B2C or B2B? Like, where are you looking to really initially launch at?
So initially, we're looking at just direct to consumers and using a network, and the Biohacker Network is a great one to kind of start with because, you're preaching to the choir. People already know about red light, so you haven't got so much education to do. But my plan long term is to make it a lot more mainstream, offer it to clinics. I have another arm going on in the background where I'm looking at, really getting the clinical piece sorted out, and then it becomes a medical device. But in the meantime, there's lots of alternative medicine clinics. Lots of people have shown an interest in being able to offer this to clients in a clinical setting.
So now I'm curious, what brought you to CryoCon? You've got this product coming out. Are you guys, you're sponsoring, but you're not necessarily ready to market. What was your interest in coming here?
So it's a conference I haven't been to. I've been to a lot of the biohacking. They're now at their 10-year anniversary, aren't they? Most of these biohacking conferences. So it's just something new. Also, there's a lot more people here that are more about B2C. And that's very interesting for me. I've just got a new sales team that have come with me to this event, and their expertise is in, looking for distributors and looking at clinics. So I just want to have those conversations. And so far it's been cool. I've been able to speak to people who are not asking me questions about, their brain illness. They're asking me questions about their business and how it scales and, what's the distributor thing, how I'm doing with the sales. So for me, that's a difference with this event.
I would agree. I think I went from last year, I went to this one, and then I went to Dave Asbury's like a couple months later, and just the people are even different. You can see it. This is business. And they're fun from different ways. But what are some of your favorite products that you're using now that maybe aren't your product, but are things that have inspired you?
Well, I'm going to say the Aura Ring. I mean, I know a lot of people might say that, but to me, that's been hugely useful. I use it all the time for myself, and I use it when I'm doing my little clinical research. So I love the Aura Ring. I've got so many different red light devices. You know, it's ridiculous, but what I've been able to do is form a little fellowship of red light companies, because some of these companies are also very, very interesting. We're all starting out. We all want to get to the same endpoint. So I have colleagues that I'm actually sharing a booth with who have a big energy bed, the Energy Lounger. That's a very cool product, and I'm lucky enough that I travel around with this guy that, you know, I get to use it. And another great company, Lumaflex, which is like a waterproof red light device. They're also here with me, very cool product. I also like to wear the blue blocking glasses. You know, I'm kind of into light. Anything to do with light, I'm a bit of a light fanatic. So yeah, I have Viva Rays, which is a company that do the blue blocking glasses where you can clip on the different shades, so you don't have to carry around like 3 pairs of glasses depending on your light environment.
Okay, so I'm going to be a little nerdy on light because I have a friend who's the founder of Mito Red Light, and he's a light nerd. I'll have to introduce you, but he's been talking a lot about the shifting of and creating light that starts from blue, going to red, and going through that. Have you guys played with any of the different light spectrums on any of the products or things that you're playing with?
For sure, yeah. It's fascinating. And actually, I was just talking to a guy. I was at Biohacking Expo last weekend, and I connected with a guy, and he's got a light, and unfortunately can't remember the name of it. It's the catch line is better than sunshine. I think it's Mito Light, and he's got a fabulous red light therapy device that goes from UV, and then it goes through the different reds, and he's also got a yellow in there. That's a great device too, and I'm going to be working closely with that guy because I think, yeah, we understand that red light is beneficial, but all of the other different wavelengths of light also have a place. So yeah, for sure, I'm going to be working more with UV light. I have another company that I've been looking at that are utilising green light for certain migraine functions, so I'll be using that too.